So I think what's unique with what we're using this device for is we're starting this at the beginning of the hospital stay. So we're measuring these patients in the emergency room as it's kind of a form of triage for what kind of care we're going to provide in the emergency room, and possibly as an indicator for whether or not these patients have silent hypoxemia that we're not noticing, and then whether or not these patients should be admitted to the hospital or not. And so far, that's been extremely successful. And then once the patient gets admitted, we're monitoring these patients at least twice a day, just to trend their responses to care and therapies. I think what's really been eye-opening is that unless you're procuring blood gases on all these patients, you really don't know what's really going on at a micro level. And I think that's what's really kind of helping us, is just to determine what's really going on there, even though their pulse oximeter may be in the low 90s and they may not be showing distress. That does not mean that's not what's going on down at a micro level. And it's giving these RTs a really valuable tool to use at the bedside to engage them. Otherwise, we're just looking at these pulse oximeters, and once again, just dyspnea in general, that might not be the best indicator. But other things that it's helping us with is conservation of PPE, which is obviously a hot topic with the pandemic. And the other thing is that we're not procuring a lot of ABGs on these patients because we have the monitors to use as substitution. And so that doesn't back up our laboratory so that they continue to expedite the COVID testing down there. So really it's helped multiple things in making sure we can be more proactive with them instead of just waiting for them to develop type 1 respiratory failure and then try to intervene. We're intervening much quicker and trying to find out what it is that's going on and then treating them. And so far, anecdotally, our ICU admission rates have just fallen off the cliff over the last 2 weeks by really implementing this. And our ICU admission rates are way down. It's been really intriguing. And the buzz around the hospital and even around the area has been, what are they doing over there? And how do we get involved with some of those things? And really what we've done is we've kind of indirectly steered the level of care in the Milwaukee area by recognizing these things that are going on, which has really shifted practice from early intubation to, hold on a second, pump the brakes. Maybe we don't have to do that. Maybe we can implement some just basic intermediate care that perhaps we're shy on at first, and then realizing if you do those in very safe environments with good protection for caregivers, that we could provide a level of care that's going to improve outcomes. And we're seeing that anecdotally here, and it's very exciting.